Epilepsy snd Seizures Learning Guide, Section 1 through Section 10 Part 2, number 1591, the 9th of April 2026, Gerald C. EclaireMD Foundation, Category, Epilepsy. Section 8, Triggers that lower seizure threshold. For example, low blood glucose. Low blood sugar reduces energy supply to brain cells. Electrolyte imbalance means abnormal levels of minerals such as sodium or potassium in the blood. These minerals help control electrical signals in nerve cells. When these levels become unstable, brain signals may also become unstable. Alcohol withdrawal or certain medications can disturb neurotransmitter balance. Neurotransmitters are chemical messengers that control signal activity between nerve cells. Some chemicals increase activity, while others reduce activity. If this balance is disturbed, nerve cells may become overly sensitive. Fever and infection can also increase brain instability. Infection may cause inflammation, which is the body's reaction to injury or illness. Inflammation can temporarily irritate brain tissue and increase signal sensitivity. Emotional stress may also influence brain stability. Stress can affect sleep quality, hormone balance, and nervous system activity, which may indirectly increase seizure risk. In many cases, a seizure does not result from a single trigger. Instead, several small triggers may accumulate and together reduce brain stability enough to produce a seizure. Section 9. Diagnosis of epilepsy. Diagnosis usually begins with clinical history. Clinical history means the doctor asks the patient and witnesses to describe what happened before, during, and after the event, because seizures often occur suddenly. Descriptions from family members or observers can be very helpful. A neurological examination is performed to evaluate brain and nervous system function. This examination may test movement, sensation, balance, coordination, reflexes, and thinking ability. Abnormal findings may suggest underlying brain injury or neurological problems. Electroencephalography, often called EEG, records electrical signals in the brain. Small sensors are placed on the scalp to measure brain electrical activity. EEG may show abnormal signal patterns that suggest increased tendency for seizures. Magnetic resonance imaging, called MRI, produces detailed images of brain structure. MRI can identify structural causes such as scar tissue, prior stroke injury, tumors, or other abnormalities that may disturb normal signal pathways. Blood tests may be used to detect metabolic problems. These tests evaluate glucose level, electrolyte balance, infection markers, and other chemical conditions that may affect brain stability. Epilepsy is usually diagnosed when a person experiences 2 or more unprovoked seizures. Unprovoked means the seizures did not result from an immediate temporary cause such as severe illness or acute injury. Repeated seizures suggest that the brain has developed a persistent tendency toward signal instability. Section 10. Treatment principles for seizures and epilepsy. After epilepsy has been diagnosed, the next step is treatment. The main goal of treatment is to prevent seizures while allowing the brain to function as normally as possible. Treatment strategies generally focus on stabilizing neuronal activity and raising the seizure threshold. Several approaches are used depending on the cause and severity of the condition. Anti-seizure medications. A most common treatment for epilepsy is medication. These drugs are often called anti-seizure medications or anti-epileptic drugs. Their main purpose is to stabilize the electrical activity of neurons. Most anti-seizure medications work through one or more of the following mechanisms. First, they reduce neuronal excitability by modifying ion channels that control electrical signaling. These drugs help prevent neurons from firing too rapidly. Second, some medications increase inhibitory signals in the brain by strengthening inhibitory neurotransmitters such as GABA. These drugs help suppress excessive electrical activity. Third, certain medications reduce excitatory signaling, particularly glutamate activity, which can otherwise promote synchronized neuronal firing. By adjusting these electrical and chemical processes, medications can significantly reduce the frequency of seizures in many patients. For a large percentage of people with epilepsy, a single medication taken regularly can provide good seizure control. Medication management. Finding the most effective medication often requires careful adjustment. Physicians usually start with a low dose and gradually increase it while monitoring seizure control and side effects. Different seizure types respond better to different medications, so identifying the seizure type is an important part of treatment planning. Some patients may require a combination of medications if one drug alone does not provide sufficient control. Surgical treatment. In some patients, seizures originate from a specific area of brain tissue that consistently generates abnormal electrical activity. If this seizure focus can be clearly identified and is located in a region that can be safely removed, surgery may be considered. Surgical treatment aims to remove or disconnect the seizure focus so that abnormal electrical activity cannot spread to the rest of the brain. Advances in imaging and neurophysiology have significantly improved the precision of epilepsy. Surgery in selected cases. Neurostimulation therapies for patients who do not respond well to medications or surgery. Several forms of neurostimulation therapy have been developed. These treatments use small implanted devices to deliver controlled electrical stimulation to specific neural pathways. Examples include vagus nerve stimulation and responsive neurostimulation. The goal of these therapies is to stabilize neural networks and reduce seizure frequency by influencing electrical activity in the brain. Lifestyle management. In addition to medical treatment, lifestyle factors can play an important role in seizure control. Maintaining regular sleep patterns is particularly important because sleep deprivation is a common seizure trigger. Stable metabolic health, proper hydration, and stress management may also help maintain a higher seizure threshold. Avoiding excessive alcohol or substances that disturb brain chemistry is generally recommended. Long-term outlook. Many people with epilepsy achieve good seizure control through medication and lifestyle management. Some individuals may eventually become seizure-free for long periods, however. Epilepsy is often a chronic condition that requires ongoing monitoring. Treatment plans may change over time as physicians adjust medications or evaluate new therapeutic options. The key objective is to maintain stable brain function while minimizing seizure risk. In the final section, we will examine how the brain adapts over time and how neural networks may reorganize after an injury or repeated seizures.